What your clock say? 7 o'clock?
No, it's more than that. 7:03.
Okay, let us start then.
Yes.
Okay.
Yeah. Okay.
Good evening and welcome to this technical meet on breast cancer awareness on behalf of American Society of Kuwait chapter. This is myself, Safdar Ali Khan, secretary, welcoming you on this wonderful evening. I will brief today agenda. We will be having HSC moment, then welcome address, which I already did it, and then president address if he's there. If he's not there, I will take lead on this. Then is speaker introduction, online quiz, felicitation of a speaker, online certificate distribution or quiz winner, and vote of thank. So let us start with HSC moment. But before going ahead with this is Zoom platform. Sometimes we will be having a poor connectivity and we will be logged out. So don't get panic. Alhamdulillah, there are 33 participants showing right now. Some may be new to SSP KC, first time they will be attending for this wonderful session. And I'm pretty sure you will be getting a good takeaway message with Dr. Anwar Al-Nazar presence, and your active participation will be adding value to this wonderful evening. So let us start with HSC moment.
There is no audio.
Ramnaji, no audio. Could you please check?
I think there is no audio. I didn't see.
Thank you, Ramana, for this presentation. Though audio was not available with us, but it say here the early detection on breast cancer awareness. There are 4 stages, and there was a research conducted in Malaysia. So early detection is a win-win situation, and we will be hearing more on this when our presenter will be available today. So I'm just giving a brief on chapter activity. Before going with the chapter activity, let me remind the president message, Mr. Jahid Thakur. Yeah, I was just talking before starting this presentation. We are passing through a very difficult time of COVID, and president message is there: take care of yourself and your surrounding. This time by maintaining a social distancing, wearing mask whenever we are going outside, and continuous hand washing whenever the appropriate opportunity is there. And good participation and new program is being pushed and continuously going with the annual plan by wise team. That is president message. Good luck to you for this from Mr. Jahid Thakur. So I will brief you about this SSP chapter activity. Those who are new to our this term, this is a brief of glimpse. You'll understanding that how this society works, what new things we are doing, and how you can be taking message from this and how you will be able to participate and contribute towards the upliftment of society and awareness. So these are some of the glimpse of a recent event we did it. Like we have started this our term from July. So in this time, we have done a various training program like hazard identification and risk assessment control on 8th of July, where 90 members were participated. And this is a process safety management technical meet. Those who are practicing process safety engineers or who are looking for a long career in this, we are meeting every third of Wednesday, where we get an opportunity to hear from a experienced and the newcomer who wanted to set foot on the process safety management journey. So all are welcome who look forward to enhance their process safety knowledge every third of Wednesday. Though our broadcast message is always forecasting most of the time, as a part of society annual general body meet every 1 year, and since we were forced to have a Zoom meeting, so this was a part of annual general body meeting held on 23rd of July, where 84 members participated. There was a training on Global OSA 101 General Worker Safety. This is a highly acclaimed international training course. After long await, we were instrumental in getting this course done. This program has run in 3 sessions, and it was done by our eminent personality, Mr. Ashok Garlapati, where 12 members benefited. Like when we took this committee term from July, so committee orientation meeting was there. There are 11 committee, different heads are there. We met with the different committee and their deputy to understand the deliverables and their role, how we will be functioning this year to achieve our target. This was another technical meet for process safety management. I was saying about every third of Wednesday. So this is another technical meet by Mr. Chandrasekhar and Moala Ram. There is another technical meet on significance and preparation of HSC plan by Mr. Arsad Ayub on 24th of August, where 60 members benefited by attending this, which is very vital for any new project HSC professional. This was a virtual ceremony of ASSP GCC HSC Excellent Award. This is to promote HSC and recognizing their best performance in form of platinum, gold, silver, and bronze for a private sector company. Those who has missed this opportunity this time, they can still see on YouTube. And in future, you can participate by engaging your company. You can see the benefit how SSP GCC Excellence Award 2020 was held and how you can best be a part of that great movement. This was technical meet on commemoration of International Day of Preservation of Ozone Layer. It was done by eminent personality, environmental engineer from KNPC, Mr. Abhay Kumar Kashyap, on 16th of September, where 45 members benefited by attending this technical meet. This is another process safety management technical meet of September, 17th September, where Muruganandan and Mr. Venkateshan has given this presentation, where 82 members benefited by attending this session. This was webinar on environment and sustainability in process industry presented by Chola MS Risk Services, and the speaker was Mr. V.S. Bhaskar, where 28 members benefited by attending this excellent webinar. This was the last WISE technical meet on risk and mental well-being during COVID-19. Alhamdulillah, this is a well-tuned program which was the very much needed at the time where people were very stressed and they are looking out for some hope, and people were having despair all around. Negativity was hearing that news and everything was under lockdown. So, and people were having a loss of jobs. So that was very good and excellent program by Dr. Al Anud Al Atiq on 24th of September, where 65 members participated and got benefited by this wonderful event by WISE team. This is another webinar on importance of LinkedIn account for HSC professional by Mr. Abdul Musawwir on 7th of October, where 95 members benefited by attending this webinar. This is process safety management technical meet number 4 on 21st of October, where Majruddin Sheikh and Mr. Salman Panwala has given their presentation, where 108 members participated. Though it is June, but it has infused interest. People from India and overseas has also attended. Like this program, right now it's running on YouTube also. So our presence is not local, we may be on global. So our audience and participation will be more. Alhamdulillah, thank you for your effort and bringing such an excellent program. We are having another group, that is Toastmasters. We believe in developing leaders, and leaders develop society and wherever they work. So as part of developing and grooming our professional, there is a Toastmaster meeting, which we are meeting of first and third of Saturday in our SSP KCC club. Those who are interested and look for joining us as a guest also, they can come. We are giving this message through our broadcast message. Once you have attended this meeting, you may be getting some more information on this. So you are welcome to join our Toastmaster meeting. Now, this program, since I was announced in beginning for mostly with the lay day, which is my initial understanding. But I will leave floor onward now to lead this session, briefing on the past WISE activity by Ms. Janet Nazare, Deputy WISE Committee. Over to you, Madam Janet Nazare.
Thank you, Mr. Safdar Ali. Good evening, everyone. Can you hear me?
Yes, dear.
Yeah. Good evening, everyone. Myself, Janet, Deputy Vice Head of Vice Committee. Vice Committee stands for Women in Safety Excellence. It is one of the committee in ASSP Kuwait chapter. ASSP Kuwait chapter's Vice Committee is formed to help coordinate Vice events such as networking, technical talks, and community at the local chapter level. Currently, at Vice Committee, we have 25 members, including 4 members in the core committee. And the core committee consists of Dr. Shekha Al-Fajam, she is the head of the committee, and myself. We have Zahida Farooq and Ahlam. 4 of us, we are in the core committee. And we are meeting regularly to share ideas, exchange information, and discuss upcoming events. So I would like to thank and I would like to encourage those who are already here, and you can just refer your friends and join our Vice Committee. to connect with the like-minded safety professionals and support the inclusion and advancement of women within the safety industry. This membership is 30 KD for Kuwaitis, and for others it is 25 KD. It is not separate membership charges. It, like, if you will become the ASSP Kuwait chapters member, you can also be a part of the WISE committee. So now we will have a glance at our previous WISE events. As Mr. Safdar Ali already informed, he briefed about this technical meet on risk and mental well-being during COVID-19. This was our recent program. There were around 65 members who participated in this program, and it was very much appreciated by everyone. Then before the previous program included professional development on health safety for women. This was the professional development conference. During that time, we had this program at the Regency Hotel, and we had a very renowned speakers during this program, and it was very much appreciated by all the participants. We had a program on panel discussion on women leadership in professional career. And here also we can see that there were very famous and renowned speakers for this program, like Sara Al-Ajmi, Rima Al-Awadi, Engineer Modi Al-Ajmi, and Samira Al-Kandri. So this was a panel discussion, and which was very apt for the women. This is also one of the program, like we did it in 2018. That was the breast cancer awareness program, the same program which we are doing now, but there was a different speaker during that time, and there was 25 vice members, and we had met in the Best Western Hotel. It was very much appreciated by the participants, and also, like, every time they keep saying that this is a very important program, and so we repeated the program in this year also. And you all know that October is the month of breast cancer awareness. So we thought that today is 31st of October. Let's have this program, and here we have the same day. We had this blood donation campaign in 2018 at Shuva Medical Center, and there were around 100 plus donors in this blood donation campaigns who donated the bloods. We had this meeting with BCSP representatives from the ASSP headquarters at Best Western Hotel. Around 65 members were available during this program. We had this women leadership challenges in oil and gas sector. This was another panel discussion program at Hubara Center at KOC. This was the first aid and CPR awareness program exclusively for our lady members and our ASSP members' spouses. Menopause, a health concern for women. This was held earlier. Technical meet on nutrition for women at every stage. It is it was the program which was very much like the participants earlier had told that they wanted this program, like something on the nutrition, which is very important for women. So we had this technical meet on this topic. Firefighting awareness program with Kuwait Fire Safety Directorate. We had this program held exclusively for women members. We had this meeting with ASSC. That time we used to call ASSC. So ASSC USA delegates. This is the same thing that before that, like meeting with ASSC USA delegates. Every year, whenever there is a PDC, we are having this meeting with the USA delegates when they were coming every 2 years. We are keeping the meeting with the women members. So also I would like to say that you have to please stay tuned for our upcoming voice event. Don't miss out on these. These are like in month of November. Now this is already, we are ending October, and in month of November, we have a program on working online. What about agronomics? This is one of the program we have planned in the month of November. In month of December, we have planned a program, Women in Health and Safety, Challenges and Opportunity. In January, we have a program called Women's Health, a sensitive topic discussion. In February, we have planned a program, Skincare Routine for Women. And then we have a blood donation campaign. And at the end, we have Women's Day Out in month of May. If everything goes well, maybe we women can meet, because this year it is not possible due to COVID. But if inshallah, if everything goes well, then in month of May, we will have a Women's Day Out. Then once again, I would like to welcome our speaker, Dr. Anwar Al-Najjar, for today's breast cancer awareness program. I would also like to thank Vice Committee Head, Dr. Shekha Al-Fajjam, for her leadership and her extraordinary commitment in arranging Vice activities. I would like
Thank
to
you.
thank my dear fellow colleague in Vice Committee, Ms. Zahida Farooq, for her support and cooperation in managing all the Vice events. Thank to ASSP Kuwait chapter, Chairman Fahad Al Ali, President Jahid Thakur, Advisory and EC Committee, and Rishi and Ramana for the support for all the Vice program. Whatever we saw now, it is all not because of one person, but it is a team efforts. So I would like to thank one and all for all their support. And I would like to say that have a great program ahead. Now over to Dr. Shekha for a speaker's introduction. Dr. Shekha, please. Thank you.
Good evening. You're welcome. Good evening, everyone. I'm Dr. Sheikh Al-Fajjam, Head of Women and Safety Excellence Committee. I would like to welcome you all for our event today, Breast Cancer Campaign. I would like to welcome Dr. Anwar Najjar. She's a consultant in family medicine, and she has also a diploma in diabetes from Dundee University. She's also, mashallah, studying now to be the first certified doctor in managing quitting smoking. Dr. Anwar Najjar, she will give us today a presentation about breast cancer, and I will leave the floor now for her to start her presentation. Thank you. So, Dr. Anwar.
Thank you very much, Dr. Sheikha. It's my pleasure that I'm joining you today in this lecture. I hope at the end you will take some messages, take home messages from it, and you will use it as things that you can have it in your life, and changes that you can do it in your life to actually protect yourself from breast cancer. If you are a woman, then you can do these life changes, and if you are a male, then you can advise your lovely woman in your life, like your wife or your sister, your mother, whatever. You can get the advices out of this lecture. I'm waiting for the slides to be shared, so we can go ahead in this lecture. Okay.
Shall I start, ma'am?
Okay, so you give me the
Yeah, just a minute.
okay. Are we
Can you
ready?
try? Yeah, you can try. Yeah, little bit. The transmission will be little bit slow. You can,
Yeah, but where is the you are changing it from your side?
no, you're changing. I'm not.
Okay, but I cannot see the. Okay. Okay, so now we'll start talking about breast cancer. I know this cancer is a little bit, some, especially women, they are afraid to talk talk about, and they feel that it's better to avoid talking about breast cancer. But actually, if we start talking about it and open our hearts and our ideas and relieving these concerns together, then of course we will get the benefit of protecting ourselves by early detection of this disease.
Just a
Uh,
minute. Let me mute myself. Um, can I use the mouse? Just a minute, ma'am. Just a second. Let me mute myself.
okay.
Ramana ji, I will
So
do.
if
May I do?
we are talking about breast cancer, then we are talking about the second most common cancer in among women after lung cancer. If we saw the statistic everywhere in the world, actually, breast cancer is the second one. And actually 2 million cases all around the world being diagnosed as breast cancer every year, and this counts really a huge number, and it's number one cause of death in among women, because if we looked at all the cause of mortality. um, Okay, so if we would like to know about breast cancer, we all women, they would ask themselves, what are the symptoms that I might have, and this would indicate that I have breast cancer. And as you can see here, that one of the symptoms is having a lump, but actually not every lump is breast cancer. So don't be scared when you have anything in your breast and you will think that this is for sure breast cancer. We have lots of benign conditions that are also presenting as a lump. Of course, this would be by clinical examination by the doctor. He will define some things in the lump that will decide that it could be a cancer or not, and of course with other investigation. Having a nipple, a pulled nipple, is also maybe a symptom of breast cancer. Having the skin with dimpling also may be a symptom of breast cancer. Dripping and having a nipple discharge may be also breast cancer, related to breast cancer, but also not every nipple discharge is breast cancer. There are lots of causes of nipple discharge. We may have infection, we may have actually hormonal imbalance that may result in nipple discharge. So don't be scared when you have nipple discharge and you will think immediately about breast cancer. Always we need to think as a holistically to see what's the reason. Also having skin changes, which, like for example, redness and rashes, and these skin lesions are not related to be as eczema or psoriasis. This may be also one reason is breast cancer, but other reasons are there also. So don't feel afraid also when you see any redness in your skin in the breast. You will feel that this is for sure breast cancer. No, there are many reasons can lead to actual breast cancer. Also, as we said, many skin changes, like for example, you may see changes in the skin, like for example when you see what we call like an appearance like an orange. When you feel the skin, it's like an orange appearance, the orange skin. We may think about skin cancer, but again, always skin changes that occurs is not always because of skin of breast cancer. So all of these symptoms are important, but the most important thing also is to understand your risk and to know where are you. Are you in a low risk group, in a moderate, or as a high risk group? And when you know your risk and you calculate it, then you will divide them as a modifiable risks and non-modifiable risks. So all women, they have both of these kind of risk, but we will each one of you, when we start talking about now about the risk and what are the things that increase the risk for any woman, then you will know where are you, and you try, of course, with more assessment with the doctor, you will understand it more, and you will know where are you are laying, in low, moderate, or high risk. Now, if we look at the risks, what are the reasons that makes a woman have higher risk than others? You can see here that being of certain ethnic groups, I'm sorry, spelling mistake here, certain ethnic groups, they have higher risk than others. And they found that, for example, in the United States, being a white lady having more risk, but actually they found that black races, actually they have more aggressive disease. So the ethnic group itself being white or black, this is not a definitive or a definite criteria to have a high risk. But there are some ethnic groups also, like Jewish, they have more tendency to have a high risk of breast cancer. Also, being a tall lady, having your height more than 175 centimeter makes you at more risk of having breast cancer. But of course, this is also not definitive. Not every tall lady she will have breast cancer, but this is found to be like a high risk for women. Being a female makes you at a high risk, but does it mean that males, they don't have breast cancer? Anybody can tell me if males, they can have breast cancer? What do you think? Anyone? If you can unmute your mic and you tell me if males, they can get breast cancer or not. Or in the chat, if you can write. Yes. So one of the participants, she said yes. Actually, yes, males can have breast cancer, but very low incidence. Actually, less than 1% of men, they can get breast cancer. Okay, so mostly the high risk is the female. Being a female, you will have a high risk of getting breast cancer, but males, they are not excluded, but with very high, very low risk. The estrogen is another reason for having breast cancer. And when we say estrogen, it means either it is an endogenous, which means that if you have from your inside the body, you have high level of estrogen because of certain estrogen imbalance, or if it is exogenous, it means that you are taking something from outside, like medicine or tablet, like ladies in the postmenopause, when they reach the menopausal time, some of them, they need to take the hormonal replacement therapy for certain issues, and at that time you may have higher risk of having breast cancer. So estrogen is a reason. At the same time, androgen, which is estrogen, what we call, it's the hormone for ladies. The other one is androgen, which is the testosterone. It's the hormone of men. But of course, women also, they have androgen. And if there is an imbalance, and there is also a high level of androgen, they may have also a high risk of having breast cancer. So either having estrogen, high estrogen, or having high androgen, any hormonal imbalance can result in increased breast cancer. Obesity. Anybody can tell me about obesity, if it is related to breast cancer or not? I like if we have like a chat between each other. If somebody can unmute his mic and tell me about obesity, how obesity affects breast cancer. Okay, some say no, some say yes. Okay, one by one. So which one is the winner? Actually, it is found that obesity can be gives the patient a high risk of having breast cancer. And they found that adipose tissue, higher adipose tissue, it means high fat in your body, makes you more prone to have breast cancer, because yes, you are right, one of them, because of the hormones. Exactly, they found that the fat in your body can excrete estrogen, and especially in post-menopausal women, when you are fat and you entered your postmenopausal time, then you will have higher risk to get breast cancer. Okay, so try your best to to reduce your weight before you reach menopause, and of course maintain your weight onward, so you protect yourself from having breast cancer. The age. What about the age? What will be who will be at risk? The older woman or the younger woman? Who will be at risk? Anybody in the chat or in the
Younger man, younger woman.
the Older,
Younger
you are right. Yes, when the woman gets older, they will have more risk to get breast cancer. You can see that a woman who's from birth to the age of 49, her risk is 1 in 49 women. When she is 50 to 59, almost 60, her risk is 1 to 42 in 42 women. Then if from 60 to almost 70, the risk increases to 1 in 28. And if it is 70 or older, then the risk is 1 in 14. So the risk increase with age. And from birth to death, the death rate will increase also from 1 to 8. So age is a factor. The woman, when she gets older, it's a higher risk. She will get higher risk to get breast cancer. Okay. Now we will go to other risk factors, other reasons for high risk group. Okay. Other reasons are when the lady have a late menopause. Anybody knows what do we mean when we say late menopause? When we consider that it is late menopause, when the woman is not having her period, when it is late. Can you give me an age? Anyone? Okay. Yes, right. It is after 55. When you are after 55 having menopause, after that, it is considered as late menopause. When you have a late menopause, this makes you at a high risk to have breast cancer. Or when you have an early menarche, the menarche, you know, it's the time when you get your first period. So when we consider that it is an early menarche, do you know? Anybody give me an age? Usually the girls, they will tend to have their period at a certain age, but we consider it as an early at what age? Okay, yes, 10, 12 is an early menarche, and actually if it is less, they found that if it is less than 15, it is considered as early for breast cancer. Okay, so it is not, it doesn't mean that it's considered to be early menarche for as a high risk of breast cancer. Do you get the point? Okay. Now, the second reason for having high risk of breast cancer is family history. Which type of family history is considered as a high risk for breast cancer? If any person in your family, any woman, of course, having breast cancer in your family makes you at a high risk. Which grade of family history? Is it a first degree, second degree, third degree? Which degree? Any answer? Yes, exactly. Excellent. The first degree. When you have a first degree, it means your mom, your sisters, or daughter, you will have a high risk of having breast cancer. And of course, if you have a male who have breast cancer, also will gives you a high risk of breast cancer. So the family history is usually is the first degree. We talked about, of course, the weight and obesity. I will not repeat the point. I'm sorry. Maybe I repeat it with a different picture. Now, previous history of having breast pathology. What do we mean by this? We have two issues. Either that you have a pathology in your, it means that you have a disease in your breast. If you have a previous history of a disease, even if it was benign, then you may have a higher risk. But it doesn't mean that every woman who have a benign problem in her breast, she will have breast cancer. She will have a higher risk. She will need more follow-up and more that we take care of, but it doesn't mean that for sure she will get breast cancer. Of course, not every benign it would turn to be cancer, no, but she will have a tendency to have maybe another lesion, okay, of having breast cancer, not the same one, maybe another lesion. Having breast surgery itself is not a reason for having breast cancer. Also, they found that women who have more density in the breast, they would tend to have a higher tendency to get breast cancer. But this is, of course, not for sure. Not every woman who should have high density in the breast, she will get breast cancer, but this makes her at a high risk. So having any lesion, previous lesion in the breast, even if it is benign, but not everyone who gets benign she will get, but it gives her, she put her at a high risk, or having a density in the breast. Okay, the other reason of putting the female at a high risk group is having a high bone density. If you have a high bone density, this makes also you as a high risk to get breast cancer. So remember all of these things as putting you at a high risk, but it doesn't mean that if you have this, then you will be anxious and you feel that I will have breast cancer for sure. This makes you at a high risk. Okay, having your child at an if you have the child before the age of 30, this makes you as a protective or
high risk group.
if you have your child at, can you hear me? Can you hear me?
Yes, ma'am.
Yes. Okay, so if you have your first child, this makes you as protective or high risk. It's put you at a protective. You are right. So if it is more than 30, then you are at a high risk. So if you are still young, get your children quickly so you will be protected from having breast cancer. Also having hormonal imbalance, as we said, high estrogen or androgen, this makes you at a high risk. Having a night shift. Actually, they found that a lady who will have night shifts in her work, she will tend to have, she will be at a high risk to get breast cancer. If there is a chance to change your work, it's okay. If there is no, then it is a high risk, but it doesn't mean that for sure everyone who have a night shift, they will have breast cancer, but it is a high risk group. Of course, alcohol. Alcohol put the lady at a high risk of having breast cancer. I will answer the questions after that. Inshallah, I will look at the chat what are the questions and I will answer all the questions. Infertility. If you don't have any child before, this makes you at a high risk of having breast cancer. Okay, smoking, and since I have like a certificate in smoking, so any smoker lady, she will have a tendency to develop breast cancer, and if she have a breast cancer and she didn't quit smoking, she will tend to have another cancer, another primary in the lung, and they have higher incidence of having another primary. So what do we mean another primary? It means that you will have another cancer in another place. It doesn't mean that the breast cancer go to the lung. No, you will have a new cancer. If you have breast cancer and still you are smoker, you will have another cancer, a new cancer in the lung. So it's very important to quit smoking if you have a breast cancer. Okay, so we talked about what are the things that makes you at a high risk. What are the things that make you protective from the breast cancer? Number one is what? What's this? Wake up. Huh? What you are seeing in the picture? How you protect yourself?
A mother breastfeeding.
Breastfeeding, excellent. So if you feed your child, if you are really breastfeeding your children, your infants, then you are protecting yourself. So this is a very important message for any woman in childbearing age. Please go ahead and breastfeed your infants, because you protect yourself and you protect your infants. The other thing is here is doing exercise. So because exercise, as we said, it will makes you, of course, you will reduce weight, and this will protect you from obesity. But even if you didn't reduce your weight, physical activity itself can protect you from breast cancer. So keep these things in your mind as a protective measures for breast cancer. Now, factors that didn't influence breast cancer, just to change some wrong ideas or misunderstanding and misconceptions. Abortion. If you had a history of abortion, this doesn't make you at a high risk of having breast cancer. If you did tubal ligation, also this is not a high risk. The caffeine, before they were thinking that if you drink lots of coffee then you will have breast cancer. This is not true. Doing cosmetic breast implants, because some ladies, they have like some problems and they need to do the cosmetic breast implants, and this is not considered as putting the lady at a high risk. Electromagnetic fields, because some people, they will think about like the Wi-Fi and the other electromagnetic, like the also the microwave and other things. This doesn't increase your risk of having breast cancer. Electric blankets, also some people, before they think that it is increasing the breast cancer. This is wrong. Also hair dyes is also not related to breast cancer. And by the way, also the deodorant, maybe I forget to mention it here, the deodorant is not related to breast cancer. So all of these are more misconception and not related to increasing your risk of having breast cancer. Okay, now when we want to know that if I need to do a breast cancer screening or I need to know my risk, we need to do certain calculation, and there are certain tools we use it to calculate your risk. Before we were saying that every woman more than 40-year-old, she just go and do mammography, but now recently they found that it is better to calculate the risk first, and then we advise the lady for screening according to the risk. And we will talk about this, and there is a tool called Gale model. This helps you to know the assessment, and this is done by the physician. So you can do it with the physician through online, or to know your risk about breast cancer. Now, why we should do screening? Why we should do the screening for breast cancer? Anybody can tell me why it is important? Anyone? Early detection, yes. Why we need to do early detection? For what? What is the value of early detection? Identify and cure, exactly. So early detection will exactly to treat, to save our lives. Excellent. So it will reduce the mortality. Actually, they found that early detection and screening, actually it will reduce the mortality, it will reduce the death, so among women, so it's reproductive. And we will cure something which is can be cured. So why not to do this and to do exactly timely treatment? Excellent. So we need to treat the woman as early as we can before it reaches stages that it is already metastasis or stage 3 or 4, where we cannot treat, the treatment will be more difficult. And of course, there are many treatments can be given. Surgery is one, chemotherapy, radiation, many kinds of treatment is available. So as soon as we discover it early, then we can cure and treat the breast cancer. So it is important to do the screening. Okay, so now there is what we call breast cancer risk classification. As I told you, that we need to assess every lady and we know her risk. And the ladies are divided into having an average risk, moderate risk, and high risk. And by using the tool, we can define the lady as having an average risk as 15%. Why we don't have a low risk? Because they found that all women, whatever their calculation is, actually they fall in the average risk. So most women, every woman will be in the average risk. So there is no low risk classification in breast cancer. Most of them, they fall in the average risk. Because yani, for sure they will have one of the factors, either the age or the whatever there are the factors that we mentioned, they will have it. So they will fall in the percentage below than 15%. Then we have the moderate risk, what we call it's the calculation will be 15 to 20%, and then the high risk is more than 20%. Why they tend to classify and to use the tool? Because they found that when we do mammography for everyone, there are at certain I will mention it in the next slide better, so you will understand it more. That when we take, for example, the average risk, if we said that everyone, like for example, if the age is under than 40, there is no risk no screening guidelines. So all guidelines, they don't recommend screening below the age of 40. And the tool, it will calculate from 35 and above. So when you do the calculation for a lady from 35 and above, even if she is in the age or this age group, which is less than 40, still it will define to you if she is actually an average risk or a moderate risk. So this is one importance why we need to use the tool. The other thing is that in the age group of 40 to 49, actually many guidelines, there is a controversy. Some guidelines, it would say go ahead and do the screening regardless of using the tools and deciding the percentage, and others would say no, we need to do the calculation. Why some guidelines would recommend to do the calculation is that because there are high possibility of false positive. What do we mean by false positive? That we will find some, when we do the mammography for this age group from 40 to 49, we will find many of them, they will have some lesions. And this will take them to do some biopsy and maybe to do some invasive procedure. And for that reason, they found that why to put all women in this problem. So they decided that better to do the calculation to know actually they have the risk or not. And for the guidelines who they don't recommend to do the mammography directly, this is number one, because of high false positive. And they decided that when you have the calculation is high, then it will be an individualized to discuss with the female or the lady what the benefit and risk to do the mammography or not to do. Okay, so they found it's better to do the calculation before going for the mammography to decrease the number of false positive, and to have an appropriate discussion with the lady, giving her the percentage. If she's actually an average, then they will discuss with her and they will be open with her that this may lead you to a false positive. If she agrees, then she can go ahead and do the mammography. But in Kuwait guidelines, actually they don't use the tool. They recommend that every woman who's 40 and above to do the mammography. Why? Because they found that it is more protective, and because the age in Kuwait, that they found high incidence of or they found some cases of breast cancer, it was below 50, so they recommended to use the 40 as a cut point. So you will find some guidelines would say start from 40, like in Kuwait, but some other guidelines, they would say from 50 and above, and some guidelines would say no, do the calculation and decide and individualize. Each case is different. For me, I think it's better to do the calculation and to decide accordingly if the woman she needs or not needs. Okay, but I'm telling you that there are different guidelines. So if you hear somebody tells you start from 40 or start from 50, you will understand why they are talking like this. Then, of course, all guidelines, they agree that 50 and above is for screening, and mammography is indicated annually. From 75 and older, although we found that when we talked before about the age, we said that the age is a factor. So why here we said that screening is not for everyone? This is because, if the lady reaches 75-year-old, then the life expectancy is an issue, because if we do for her mammography and we do the mammography, we want to save her life. But if her life expectancy is less than 10 years, then what's the value to do the mammography? It will not increase the survival rate. Okay, for how we can calculate this, the life expectancy, that the lady having too much diseases, comorbidities, it means that many other diseases. So her life expectancy will be less than 10. So what's the value to do the mammography? But if we decided that her life expectancy will be more than 10 years, then we can do the screening, and it is recommended to be like every 2 years. So this is for the ladies who are, most of us will be falling in the average risk group, but there are some, of course, they are in the moderate risk, as we said, from the percentage will be in the tool from 15 to 20%. And there are high risk groups which they need a referral, and for the screening clinic, they may need genetic counseling, they need other things other than doing only the screening, not only the mammography, they need other things. Okay. I hope you are with me, huh? Anybody sleep or still awake? Okay, so now we will talk about what are the modalities, how we will screen the ladies. We have the mammography, we have ultrasound, we have MRI. Which one is the best? Yalla, tell me, which one is the best for screening? I said the tool when I'm talking. Okay, some say MRI, some say mammography, ultrasound, and on the age. Okay. Okay. Actually, mammography is the preferred one. Okay. But as we said, we will not do mammography except from 40 and above. Okay, because less than 40 mammography will give us high false positive. We will not do any we are not supposed to do for an average lady. We are talking about an average risk. Okay, so a lady who have an average risk, we will go for mammography as the best modality to detect or to screen breast cancer. But if she's younger than 40, we will maybe do other things, but we have to know that ultrasound is actually not recommended as a tool for diagnosing breast cancer. It is actually used for follow-up of any abnormality that is seen in the breast. For MRI also, it's not recommended. It's also used to follow up the abnormalities in the breast. So the best one is mammography for screening. It found that compared to the ultrasound and MRI, it's the one to reduce the mortality and to help in early detection and increasing the survival. So the mammography is the best. The mammography, just to know that it is as you see here in the picture, that the lady will be here and they will put the breast between two in the device, and they will just compress the breast, and they will do it for the right two pictures, and then for the left two pictures. And there is the film mammography, and there is the digital. Of course, the digital is better, and when the age is young, then we can use the digital, or for the breast which is dense breast, as in the young ages also, it's better to use the digital. In Kuwait, most of the centers, they have it as a digital, maybe some centers, but I don't know. But in the past, they used to have the film, but most of the centers now, they have it as a digital type. Of course, some women, they tend to not to go for doing the test, because they are worried about the pain. There is some pain when they compress the breast, but it's not that. It depends, the pain threshold differs from one person to another. Some ladies, they will have too much pain because they feel too much pain, others are not. So it depends from person to person, but it's a very important test to be done. So don't worry about the pain. Worry about that you don't know about what's happening in your breast and not doing the mammography. Now, what about self-examination? What do you think? Do you think that self-examination, let me go back. Did you read anything or not yet? Wait, don't read. Okay. What about self-examination? Do we still recommend doing self-examination, that each lady has to learn how to do self-examination herself? Any answers? I can see that. Yes. Somebody says yes. Okay. Actually, now it's not recommended for an average woman. Before, they would tend to say that every woman should learn how to do the exact way of self-examination. Now, the recommendation, even from the WHO, they said that we just need to know our normal. So we don't need that. Before, they were saying that you need to specify a date in every menstrual cycle, and in this date you need to breast examine you do a breast self-examination and in a certain way. Now the recommendation that this self-examination would not be used as a screening to reduce death and to improve survival for early detection. So now they recommend that you need to know your breast. Just know what the normal for yourself, and if you find, it is advised that any woman find any abnormality to go to the doctor and to talk to them. So it's not that before we say that every month you need to do breast examination. Now you just look at your breast from now and then and detect any abnormality and know you're normal. Okay, so it's no need to do it. Yes. Okay, what about the clinical? That before there was they used to have like a clinic in primary care centers, and the women tend to go there and the doctor examine their breasts even if they don't have any problem. What do you think, this would help or not, the clinical breast examination? Okay, no. Anyone else?
Yes, ma'am.
Yes, some says yes, some says no. Okay, actually, they found that performing clinical breast examination is not helpful as a screening measure. If we want to do a screening, the best way is mammography, and doing clinical breast examination for every lady will not improve the survival and will not reduce the mortality. When we say screening, it means that we want a tool that, as we said, increase survival, decrease mortality. Does clinical breast examination have this? Actually not. So it's not recommended that if you don't have any abnormality, just to go to the doctor and just to be examined by the physician. But if you have any abnormality, it's important that the doctor examine and see what's the abnormality, and accordingly will advise you regarding to do any further investigation. So clinical examination is not an important issue. Now, since we are in COVID-19, so what's needed for a lady who have breast cancer, not the one who doesn't have, the one who have breast cancer, just to know, of course, these patients, whatever their stage, whatever they, please stay home. And this is for everyone, not only for breast cancer patient. We need to stay at home because this is the most important protective measure. You need to continue on a treatment. Don't feel that my treatment is lowering my immunity, then I need to stop it. No, this is wrong. You need to take your medication, because curing your breast cancer is really important issue. So don't stop your medication and continue going to your doctor, but balance your appointment. So if there is, like now there are some clinics, they have them virtual calls and other things. So you may use this, or try to balance your appointments according to the importance and needs. And please, if you are a breast cancer, take the influenza vaccine and the pneumococcal vaccine, because you are at high risk, then you need this vaccine. And the Ministry of Health, now they start the campaign. I know now it started for Kuwaiti, but soon they will start it also for non-Kuwaiti. So it's very important for you, as if you have breast cancer, to take the influenza vaccine. Of course, for everyone it's important, but for those who have breast cancer, it's of more importance. So the take-home messages, Screening is the greatest value for those patients most likely to develop breast cancer and for whom early treatment is more effective than later treatment in reducing mortality. So it's very important to do the screening for females. Perform risk assessment with your family physician and share the decision. So try to go to the, or if you have a virtual consultation with a family medicine physician, he may do the calculation for you and see what's your risk, and then discuss with him and share the management, the decision to do or not to do, and what to do exactly. And early detection really matters. So if you really do early detection, then this will help you to improve the survival and decrease the mortality. Thank you very much. I hope you enjoyed the lecture. Okay, now we will go for the questions. Okay.
Yeah.
Wow, we have many questions. Okay, so let me just go quickly and see them. Take calcium to avoid osteoporosis. For osteoporosis, actually calcium is very important, and also vitamin D. If you take calcium and you don't have vitamin D, you didn't solve the problem. So the most important is vitamin D, because you need it to use the calcium out of this. And if you cannot tolerate calcium as tablet, then try to adjust your food. Okay, usually I tell my patients try to take minimum 3 to 4 portions of dairy products to help you for osteoporosis and to give you the calcium amount that you need if you cannot tolerate the calcium. Because calcium tablet can cause constipation, and many people, they don't tolerate it. What about TSH? Actually, the thyroid, they didn't find that it's it's a cause or put the patient at a high risk for having breast cancer. Why night shift is a high risk? I don't know, and nobody knows. They just find it like an observation. As we said, even for the tall lady, we said that it is an observation. They found that they have a high risk, but they don't know why. Okay, maybe the stress, because the night shift, I'm just saying maybe the stress a factor, because having a night shift put the lady at a high stressful condition, and stress itself makes the psychological issue, makes the person at low immunity and more at risk of developing cancers and other things. Can fibroid in breast lead to breast cancer? We said that any breast pathology can, maybe, but it's not for sure. Not every fibroadenoma, they don't call it fibroids or fibroadenoma leads to cancer. We are not sure. That's why now they tell that if there is any lesion in the breast, they prefer to remove it and to be sure under the microscopy to know what's exactly. Before they just in the past, in the guidelines before, they say just keep any benign lesion. Now they tend to remove it. They prefer to remove it and check it exactly. But we cannot tell that every fibroadenoma or fibroid can lead to breast cancer. We are not sure. Okay. So mammography is the best? Yes, is the best. No need for self-examination or checking by doctor? Yes, you are right. How many mammography without go to the doctor? Sorry? How make mammography without going to the doctor? For Kuwaiti, they have the national campaign that you can go through an application and you book your appointment directly without going to the doctor. For non-Kuwaiti, they can do this through 2 ways. Either you go to the family physician, they refer you to the surgeon, and then they book for you a mammography, and this is really takes long time, and you may take very long time, or you do it in the private, and before we had a campaign. I hope I will inform you if it's extending. We were having a discount on the mammography, and you will have an assessment through virtual clinic for mammography, but it has to be done through the private if you don't want to go to the doctor in the private hospitals. In Kuwait, without seeing a doctor, just may take an appointment. Yes, just take an appointment. About pills, the contraceptive pills, actually it's a hormone, but they didn't find that it's for sure leads to cancer. Of course, we are talking about the combined type contraceptive pills that contains estrogen and progesterone. I don't want to give any repetition for any contraceptive pills, but examples like Yasmin and others. Okay, so any contraceptive pills, they contain estrogen and progesterone. They didn't find that for sure they would lead for breast cancer, but if a woman have breast cancer, should stop the pills. Okay, I hope I answered your question. Okay, the Ministry of Health, yes. Also the approach high. Uh, Prolactin high, what should be done if you have a high prolactin? That this is another issue. Lots of things can be have to be done. So there are reasons which is central, there are reasons which are peripheral, so this is a long talk. You need to consult a family doctor and then maybe an endocrinologist. If we take painkiller during period, it will increase risk of breast cancer. No, it will not. What about pills? I answered this. Okay, thank you. What are which breast cancer present for men, for women in Kuwait? I didn't understand. What are they? Which are breast cancer percent? Percent, yes. For men, it's less than 1%. This is worldwide. For women, as we said, it's in Kuwait and everywhere in the world. I'm not sure about the percentage exactly, but it's the second most common cancer in the whole world. Okay. Can IUCD leads to cancer? No. IUCD doesn't lead to cancer. And as we said, even the combined pills, they don't cause cancer. But if you have cancer, you should stop it. Okay, thank you so much. What should be the frequency for mammography after 50 years? Annually, every year you should do. Okay, if you are 50 and above. If you are 40 to 49, then as we said, you need to do the calculation, and then we decide to do it annually or every 2 years. We have to define what are you. Is it you are average, moderate, or high risk? Okay, do we have to go in a specific day for mammo? Before, they used to tell that you need to go from day 5 to day 10 of the period, but now they found that it's not that much related, so it can be done not related to the period time. Okay, but before they were saying from day 5 to day 10. Okay, I hope I answered your question. Okay, we are done with the question. Anyone would like to ask any question from the chat? Who would like to open the mic and ask any question?
Madam, I disabled the chat box for some reason, because we'll open it again, because we have another thing to do. There is a quiz, no, we have to give the quiz to the participants so that they will answer the.
I'm sorry, maybe we had long time for the lecture.
Yeah, question and answers. Not a problem, ma'am. We have still time. Okay, so I'll give that this one quiz, so that participants will participate in the quiz.
Okay.
And later we can continue.
Thank you very much for inviting me, and all the best for everyone. And see you soon, inshallah. Thank you so much.
We'll carry on. Yeah, Sardarji. Yeah, good evening, all. I'm going to post the link for the quiz. Please answer your answers so that you will get certificate also for participation. Okay, and after 2 minutes, we'll continue with the question and answer session. Okay, there are 5 questions. 5 or 4, let me see. Yeah, there are 5 questions. Just answer those questions. It will take only maximum 2 minutes. Okay. After that, we'll continue with the question and answer session.
What your clock says? 7 o'clock?
Not 7. It is
More than that, 7:38.
8.
Okay, let us start then.
One, two, three. 1, 2, 3. Can I ask my question?
Yeah, the chat box is ready. If you have any questions, you can continue with the chat box. Thank you. Okay, I request everyone to open your camera so it's possible. We'll take some snapshots meantime. Only few cameras, ma'am, because most of our people are working in oil and gas sector. So only few people having camera phones, camera device. Okay, thank you. And any question and answers, if somebody wants to ask any question, you can raise. Doctor is here to answer.
One, two, 1, 2. Can I ask a question, please?
Yes, anyone would like to ask a question?
For me, I would like to clarify a point, Dr. Anwar. So if anyone had a lump, even if it is benign, based on what I've understand in the presentation, that it's better to be removed.
This is what they tend now to think about, that better to be removed and to check what is it exactly. And of course, this is a decision with the surgeon. Yani we cannot tell that everyone should do this, but now before they were saying no, keep it, you can, it's a benign condition, you can live with it, there is no issue. But recently they thought that better to be removed and not watch it. And this is, as I said, it's a decision that to be shared with the patient. They will give her all the, maybe they will take, of course, the fine needle aspiration or biopsy or other things, and they will have a shared decision with her. But this is, yani, usually we tell this is a broad term, that better to remove, but not for every, yani, there are cases they will say, no, I would like to stay with it, I'm happy, I don't have any, I will not think about it, you know. So it's personality changes. I hope I answered your question.
Yeah, okay. Because many people, they ask us this question, that I have a lump, do I have to remove it? Is going to return into, is it true that it will be malignant in the future? We always hear these type of questions.
Yeah, you are right. Usually they tend to ask this question, but it depends.
Okay.
I usually say that individualizing the management for every patient in any disease is very important. That's why we said that doing like now the tool that it's now it's being used with the Gale model. Of course, Gale model have some limitation. I'm not saying that the Gale model is the best model to be used, but at least this model is helping us to stratify our or classify our patient. But there are some limitation, like for example, it doesn't include all the ethnic groups, like for example Arabic people, or it will include most of them. So when we do the calculation, usually we choose like white for the Arabic people, but if they have, and it includes like Indian American, Afro American, there are different classification. But although we have some limitation, but still we are individualizing our patient. So a management plan is not equal for all patients. We have to understand the patient and to individualize the management for any case.
One question, please.
Yes.
Some of my family members died with different cancers.
Yes.
Are there relationship between them or no?
Ovarian cancer can be related.
Can be related with the breast cancer?
Yeah, it's maybe related to breast cancer.
So I
Yes.
have to do this mammography.
You need, but as we said, that your family, is it a first degree, second degree, third degree?
Second degree.
Second degree, so you don't need to be that much worried about it, because usually we said that the first degree relative is more important.
Okay, thank you so much.
Okay, so don't feel anxious and stressed because one of your family died because of
not only one of most a lot of maybe 4 or 5%.
But it's usually we look at the first degree, but we cannot say that second degree is totally eliminated, but the risk will be less.
Okay.
The risk is less, but we cannot for sure say that it's totally eliminated.
Okay, thank you.
But breast cancer is related to ovarian cancer, so we need to know which type of cancer it is.
Clear. Thank you so much.
Very cute. What is it? Again.
My daughter. Come.
Hi.
Say hi. She is shy.
Okay. Any other question?
Too
many messages. I'm sorry, it's too much, but I'm trying to give you as much as I can of important messages. Thank you. Breast cancer, is it possible to be treated with the stem cell? Actually, stem cells, it's been used in many diseases. Is it helpful in every disease? We cannot say for sure. It's been used for even for knee, for the hair, for everywhere. It's a new type or a new modality of treatment. Still, we need lots of studies and research to decide. Sorry. Still, we need lots
Carry
of
on, ma'am.
researchers to decide that it is good or bad. Okay, and when we say that many studies, we need a well-established studies, case control studies, and good reviews. That after that we can say it's good or bad. But generally, still, it's a new type of modality of treatment. Didn't show in as in my as I know, it doesn't show in breast cancer an efficacy, but in some other problems, other diseases, there is some efficacy. Okay, any other question?
Okay, I would like to ask one more question. It's about genetic counseling. For example, we heard about Angelina Jolie, that she did a genetic screening or something, and she found that she has a gene related to the cancer. That's why she removed her. She removed her breast as
Protect
a protective measure. Yeah. Does this exist in Kuwait?
Yes.
To do a genetic.
Yes, it is available. Actually, certain genes, as we said, it's more related to cancer, as we said. But doing the test, it's available here in Kuwait, but it's very expensive. In a private, it's around 500 KD if you want to do it in private. In the governmental hospital, as I told you, there are criteria. We said that there's a classification. We have average, moderate, and high risk. And the high risk, actually, maybe they need to do the genetic study, and this is to be referred and to be done. So it is available. It is there. Okay, but does that means that if you have this gene possibility to remove the breast, there is no. I didn't read a recommendation saying that, but it would say that if you are a high risk, then high risk, and you have this genetic predisposition, then you need to be more concerned to have the protective measures, to do the screening, to do these things. If she removed the breast, is she does she protect herself? Is she sure that she removed every single cell in the breast by mastectomy, removing the breast? Are we sure? So no. Okay, so always there, even when she removed the whole breast, she might still have the possibility of having the breast cancer, because maybe there are some remaining cells, right? You cannot be sure that you removed all the cells. So doing that, actually, I don't think it's a
clever thing. Smart.
It's better to think about other things. Protect yourself. Do things, screening better. Okay, so I would do this if inshallah, not me, but I'm saying if any person have a high risk and have this gene, then it's better to do it that way, to think that way, think positively, don't think in a negative way. Okay, always think positive.
Okay.
Can tight-fitting clothes affect too? No, doesn't relate. Tight-fitting clothes doesn't cause cancer. Okay, it will cause for you pain. It can cause for you irritation. It can cause for you skin changes. It will be painful. You may get, but other than this, do you get breast cancer? No. But don't put something tight, because it will hurt yourself. You will hurt yourself. Okay. Any other question? Okay. I think we are done with questions.
Yeah, thank you. Thank you very much for this very interesting talk, to be honest. For me, there are many new information that I know about it, to be honest, like about the self-examination, about the mammogram. They used to say, for example, for us, always go on the 10th day, the period, and and this makes us under stress, because every time we forget and we just wait for the next one. But yeah, it's really a little bit relieving for us to know that we can go at any time.
And all the information that I told you about, it's from a site called Up to Date, which is a very important source for most of the physicians. They use it because it's use all the researchers, and they try to put most of the information which is well studied. So I hope it was it's giving you some important information. Okay,
Yes,
so
very
thank you
good,
very
ma'am.
much.
Yeah, our secretary will be here.
Yes,
Dr.
yes.
Shekha will be there. She will do the
You
felicitation.
can
Who will
invite
do it?
Dr.
Shekha will be
Sekhar.
there.
Yeah.
Yeah,
Dr.
ma'am, Dr. Sheikha.
Yeah, thank you very much, Anwar, for your presentation. And we would like to give you a certificate as appreciation for your time, for your preparation. To be honest, we really thank you for your for the all information that you shared with us. Thank you.
Thank you so much.
Thank you. Now the quiz winners I'm going to announce. Congratulations, Sarah Yasmin Anush Muhammad. You are the first winner who answered 5 out of 5. Ramu Muwala, again, you answered 5 out of 5. Congratulations. Congratulations, Aziz Oluwasein Erinle. You answered 4 out of 5. And Aduba Inam, actually, it should be the previous slide. I missed it actually. You answered 5 out of 5. Congratulations. Duriya, you answered 5 out of 5, sorry, 4 out of 5. And these are the quick answers what we received. Thank you very much. And over to you, Ms. Jahida.
Assalamu alaikum, everyone. Our Honorable Chairman, our respected President of ASSP Kuwait Chapter, our today's speaker, Dr. Anwar Al-Najjar, and our esteemed guest, ladies and gentlemen, a warm evening to all of you from Zahida Farooq. It's my honor to present the vote of thanks. Before starting, I would like to praise to Almighty Allah, who is protecting in this situation. Because of that, we are healthy and gathered here today, Alhamdulillah. On behalf of Vice Committee of ASSP Kuwait Chapter, I would like to convey my sincere thanks to Dr. Anwar Al-Najjar for having devoted your time and for sharing the beneficial session, which each line by line you explained very clearly, so that it leads to increase our knowledge and attention to take proper care of our health. Thank you so much, Doctor, once again. I also extend my sincere thanks to ASSP Kuwait Chapter EC member, our Head of Vice Committee, Dr. Sheikha, our Vice Committee members, Ms. Janet and Ms. Ahlam, and the whole team who worked behind and provide their support for making this event successful. Thank you once again to all of you. Have a nice evening. Stay safe and stay healthy. Thank you very much.
Thank you, Ms. Jahida Farooq. Now, if anyone wants to talk something or open your mic to have a network session, you can carry on.
Ramana, did you take the group picture?
Yeah, we already took. That's why I asked everyone to open their cameras.
Okay, thank
because
you.
people will be leaving the end of the session. So in the meantime, in the mid of the session, I asked them to open their cameras. It's okay. Captured enough pictures.
Thank you.
Okay. It is network session, networking session. You can carry on, Miss Janet.
Nobody is giving the feedback, then we can just
Close
finish
it.
the session. If there is no feedback from anyone, then we can finish the session. Let me close it now because it's already time up.
Yeah. Okay then. Thank you.
Thank you, Ramana. Thank you very much.
Thank
very
you.
much,
Thank you
Ramana.
all for participating.
Thank you, Doctor.
Thanet and Doctor, for everyone. Thank you so much. It was a
Thank
great
you,
session.
Zahida.
Around 60 people
Awesome.
attended. Yeah.